everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. Welcome to our COVID-19 local information program. It is Tuesday, June 23rd.
That's right.
This is
that's good.
Week what? What are we now? 14?
15.
Is it 15?
Uh-huh.
Wow.
Yeah.
And show number 54.
Something like that.
Because last Tuesday it was 50.
That's right. Wow, look at you.
And we do 4 shows a week.
We do 4 shows a week. Until next week.
Until next week.
And then it is...
Will not. 2 shows a week,
right.
Everybody. We're gonna back off a little bit because things are opening back up, and so we think that people are busy and they're not maybe at home to watch us every morning
to binge Megan and Scott.
That's right. So it'll be Monday and Thursday at 9 a.m. Beginning next week.
That's right.
So
we want to keep the people informed, keep the good news and the good stories and interviews coming, but
definitely.
Also be cognizant of changing and shifting seasons.
Exactly. Well, and changing priorities, and as things hopefully open back up and we keep doing the right thing and we can keep opening back up, that's what we want.
That's what we want.
To get closer back to normal. And
that's right.
We didn't have the show pre-March, so it may go away one of these days.
One of these days. But for now...
It's going to 2 days a week.
It's going to 2 days a week.
Next week.
That's right.
That's right. So on the show today, and thanks to you, because you were kind of the show booker today for our guests.
Show booker.
Yeah. So there you go. You get credit for that.
Well, we toss back and forth the bookings.
We do. Yeah, we do. That's true. But
this was a twofer, as you say.
Yes, exactly. So we're going to talk about like mental health, right? Because that's an ongoing concern and issue for folks with all that's going on. And then also students and Native students specifically. And so those will be really good people to talk to. I'm looking forward to it.
Yes.
So there is that. And but we'll get started the way we always do. We're talking numbers.
Talking numbers. Let's do it.
Okay, you've got your national. I got the local ones ready. If you want to do that,
I got national.
She's ready. Okay,
I'm ready.
There you go.
Always.
Okay.
As of Monday night, 2,311,997 cases of COVID-19 have been reported in the United States alone, an increase of 32,122 from yesterday. So that's a significant leap.
Right.
That's a big one.
Definitely.
We haven't seen that in a while.
That's true.
And 120,402 deaths have been attributed to the virus, an increase of 433 from yesterday. This comes from the Johns Hopkins University COVID-19 dashboard.
We appreciate that. We appreciate the one fan who told us not to go away. Thank you.
For now.
We're still here. We're still here twice a week.
Twice a week.
It's okay. But thank you. And but we appreciate that. So, so there you go.
Cool.
Nice, right?
Thanks, guys.
Yeah. So I'm looking.
Always feels nice. Did you get it?
Exactly. I'm looking. I had them there.
Okay.
And here they come.
I mean, I can keep going.
Oh, you could? Yeah, please.
Sure.
Yeah, please.
Sure.
But we're ready when you're done.
Well, so we talk about tests and the amount of tests, right? So we've taken 27,553,581 tests conducted in the United States, which is an increase of 468,681 tests. So we're increasing almost 500,000 each time.
Okay.
8.4% have come back positive.
Okay.
There you go.
Gotcha. So, and the idea being, as you increase tests, you're hoping that those numbers, that positive number, doesn't keep increasing.
Of course.
With more tests.
Of course.
Right. That would be a good thing. So there you go.
Nice analysis.
Yeah, you're
Scott.
welcome. Yeah, exactly. I'm sure we can find someone that could do a little bit better than that. But there you go. All right. So in New Mexico, the numbers that we want to share are here, and so let me clear the screen just to start that up. But as we can see now, we had 128 new cases across the state yesterday for a total of 10,694. 11 new cases in San Juan County. So again, that's somewhat low from what we've been seeing. But the significant thing is across our state on Monday, no deaths reported.
Yeah. From
COVID-19. So that means no deaths in San Juan County, and the recoveries are up by 58.
There you go.
So again, I think that is
Numbers
notable.
Are looking better.
I think they are.
They are.
You know, I mean, even though we see them every day, I really would love to find a graph that shows that 7-day
That's right.
Average.
County, we're talking to you.
We're talking to you, San Juan County. But we'll
look us up.
But we will see. As we scroll down on the website, again, this is ksje.com/news. Notable, too, from the Navajo Nation on Monday, 0 deaths.
Yes.
So
0 deaths in
55 more cases.
County as well, right?
Sorry?
Sorry, 0 deaths in La Plata County as well.
Well, they have less numbers, and
Right.
so they definitely have less numbers from Monday for sure. But yes, but 0 deaths from the reservation, and then also, which includes parts of 3 states: Utah, Arizona, New Mexico.
Correct.
0 deaths there, and 0 deaths across New Mexico. I think that's notable.
It is notable, especially since the Navajo Nation was featured on the Economist podcast yesterday.
Which is one that you listened to.
Of course.
You were telling me.
Nerdvana.
Right.
But the what's notable about that, of course,
this is an NPR product, right?
No. The Economist is
pardon
an
me.
international
Okay.
news source, but it comes out of the UK.
Okay.
So it's
Well,
pretty notable that
We won't hold that against them. Go
because the marmot,
right. Exactly.
weird diets.
Yes. Anywho,
You know, the revolution was a while ago, right? Like, we're friends now.
we won.
We're
I know.
besties.
Yes.
Okay, so
Yes.
anyway, point being, it's notable, I think, that the Navajo Nation made The Economist. They don't often report on issues from Native American tribal lands. That's not a normal reporting for them. And so it was helpful. And what was most interesting, I thought, was they were talking about, which we've mentioned before briefly on the show, that if elderly folks are higher risk, ergo they tend to die in higher numbers. But the Navajo culture is primarily an oral tradition, so they pass on stories and cultures and rituals and stuff orally, so it's not written really anywhere. And they rely on elders to do this. And so they were talking a bit about the plight in that regard, but also that they had consulted some elders, and one of the most interesting, I guess, way of speaking about diseases or whatever, the way of talking about disasters, was they are frequently say something to the effect of, the disease has come to greet them.
Okay.
Right. And so it's very poetic, but it's the idea behind it, upon further questioning, was, like, what does it mean when you say the disease comes to greet them? Well, that's how they talk about spirits coming to greet, right? Animals coming to greet. And so the idea is that though a virus is an enemy, it's one to be greeted and respected as opposed to feared.
Interesting.
I know.
Okay. I like
Interesting,
that.
right?
Yeah. And I think we've learned we do need to respect this virus.
That is why we wear masks and stuff.
That's right.
And avoid large crowds.
Very true. Very true.
Yes.
I did want to show one more thing from
Sure.
the state numbers that I did pull up this morning, and that would be the dashboard, again, for the state. We can kind of see a little bit of the statewide breakdown. And then when I click on San Juan County, of course, we can kind of see our numbers there. And I don't know if you can read that because it's kind of small.
You know what's great about this? Didn't we used to, this is green now. Weren't we like red or orange or
We
something?
were red. We were one of the highest, but I think they've
Yeah.
kind of adjusted that scale.
Yeah,
Well, they've
okay.
adjusted the scale because now there's unfortunately, a lot more counties, I think, that would be in that red category. So
Right.
we've kind of put it back down.
Right,
But
got
yeah.
it.
But there you go. But we remind you that the state is kind of breaking these things down county by county, even zip code by zip code, if you're that into the numbers and wonky and want to check it out. But I mean, it is worth looking
More
at.
wonk.
Yes.
I'm wonky.
Because I think, 87401, which is the major Farmington zip code, is still a pretty high
That's right.
zip code. And so it's something that may be worth your time. The age breakdown, again, county by county. In San Juan County, you can see it there. The gender, again, more female cases than male in San Juan County.
Right.
So there is that as well. But we want to share that with you. And, of course, you can link to that again from ksje.com. It's the state health department's COVID-19 dashboard, and kudos to them for putting all that information together and making it accessible to folks across our state. So we appreciate that. But again, 0 deaths, I think, for the state and the reservation on Monday is a great thing to celebrate.
Big thing to celebrate.
Yeah, so that's important. So we are waiting for our first guest to call in,
Correct.
and she'll be calling in shortly. But in the meantime, what else has been going on?
What else has been going on? Well, that was the most interesting.
That kind of really leaves it wide open. I'm a little scared that I said that.
Yeah.
Yeah, because you could come up with
should
anything.
be.
Yeah.
I can come up with anything. That was the most poetic and notable, I think.
I liked it.
Yeah.
I did like it. Yeah.
And it's, again, when international news sources clamor, it's not, again, and this is actually somewhat tragic. We don't often cover those lands. So it's notable when they do. So
Right. Very true. We
our
do
phone's
that.
lighting up.
Our phones are lighting up. What did you say that lit up the phones?
The call.
Please call. Call. Very good. Good morning. You're on KSJE. Thanks for calling in.
Good morning. This is Dr. Layton with ATD Behavioral Health. How are you?
Hi, Dr. Layton. We're good. Dr. Amber Layton is joining us from Behavioral Health, and we appreciate that.
We do appreciate that. We haven't discussed behavioral health or mental health in a while on our show. I think we pulled somebody in maybe the third week or something. So
Right.
I think it's always helpful, primarily because there might be some folks that are experiencing new mental health difficulties and symptoms that maybe they actually haven't experienced before. This might be sort of a catalyzing event for that. So can you speak to maybe that? Maybe you've seen an increase in that kind of stuff, but also maybe some coping skills and tools that people can use if they find themselves experiencing this for the first time.
Yeah, sure. So I have seen some different changes in different clientele statuses that we've been working with. For example, some of my clients that seem to be less anxiety provoked once all of this pandemic began started to really experience more anxiety-related type symptoms, mostly due to kind of the unknown, right? Like we all kind of are experiencing what's going to happen next. Where do we go from here? I had all this free time off, and maybe I was making more money on unemployment, and now I'm not. And so there's just a lot of key factors that could be causing some increased anxiety for a lot of individuals out there, especially introverted people who enjoy being around others. Right now we're being told to social distance, which I don't agree with that term. I think it needs to be physical distancing, but we need to be more socially engaged as a society in general. So watching for those kind of signs of low motivation, increased anxiety, things we can do for that. Journaling is always good. I know it's kind of a hard thing to do, but we can write down our thoughts and what's causing us our distress. Going for walks, it's still free to go outside and do things, and just kind of really being in the moment, enjoying, the changes that have come upon us, whether we enjoy it or not, but being mindful and present in those moments can help as well.
Right. And, Scott and I have been saying physically distance since this all began.
We've been
wanna
using that
point
term
that
a
out.
lot on this
Thank
program.
God an expert finally agrees.
Thank you very much.
Thank you for that. Part of that is dealing with uncertainty, of course, which is very difficult. But also I'm wondering, this has been kind of a constant process of developing information. Now we're phasing back into life, and maybe you could speak to some of the difficulties you had mentioned people that had been unable to go to work. Now they're thrust back into the work environment, or trying to navigate social circles where we can see maybe some people outside, but we can't see everybody outside, and maybe the interpersonal difficulty that comes with that as well.
Yeah, for sure. And so, it's kind of funny, like when I go out and about, it feels like there's like people have this sense of freedom now. And so I think some people are forgetting, and so you see people without masks and people being close to people in the lines and things like that. So it was kind of like, we all were at the starting gate ready to go back into society. And then we forget that this virus is still very prevalent and it is very real. And so just making sure that even if we don't agree with some of the things people have told us to do or the mandates, that we need to be respectful and kind to others and respect them as well. And so, some of the big issues is like half the stuff's open, right? Like even my clinic, we're not open yet. We're still doing telehealth, so virtual. And I have some clients who now are facing having to pay daycare rates again, which they were like, I haven't paid these in years because my kids aren't daycare age, but Boys and Girls Club's not open, or some of these after-school summer programs aren't. And so they're finding themselves having to kind of struggle to, maybe make less money going back to work because unemployment was paying them more, and now they have this added expensive daycare, and it's just real stressful to figure out what to do with themselves as well as their children. And then, of course, finances are always a big factor in a lot of people's stress loads, and so trying to navigate all of that.
Very true. And Dr. Layton, I guess I wanted to ask you a bit, since this has been going on now for 3 months.
Yeah, over 90 days.
Over 90 days. And certainly that's got to have an impact on folks as well. And as you've been mentioning, maybe some folks felt, early on in March and in April, they were keeping it together pretty good and just dealing with all the things that we're dealing with. But now after all this time, is it understandable that some folks may be a little more stressed, a little more concerned, a little more maybe in need of talking to someone like yourself?
Absolutely. Yeah, we've really seen our call-in numbers kind of increase. I know that there's some frustration still because we aren't open. But people are. It's like I said, there's just so much uncertainty, right? It's like we turn on the news, which is not always the best for our mental health, but we turn it on and we watch it, and one day they're saying wear masks, the next day they're saying don't wear masks, and then, they go back and forth because we really don't know. Like, as a scientist, we really truly don't know the capability of this virus and how it's going to change and how it has changed. And so we're all just kind of doing the best we can. And so for people that have anxiety, that kind of unknowing, we don't really know, it's day to day, that's very stressful for them because a lot of times people who can make a consistent plan, it keeps their anxiety at bay, right? And so we want them to just know that, like, it's okay to not have a full plan and to just kind of be in the moment. And that's really where that mindfulness comes back to. It's taught a lot in therapy. You can look at the Buddhist culture about being mindful and just kind of being in the, okay, today this is what we have to do. This is what they're recommending. Know that, yes, the schools haven't released what they're going to do in the fall, but we will make a plan when that happens, and just kind of being okay with not knowing, because we kind of live in a society where we want everything at our fingertips and we want to know, and that's not reality right now.
So you had mentioned that you guys are still doing telehealth in your offices. Do you talk a little bit about, from the perspective of a provider, how difficult that change has been? We have a lot of providers that had to switch to telehealth on a dime. So what's that been like?
Right. So telehealth for behavioral health has been around for a long time. So we actually rolled it out last fall, mostly to support people that lived long distances so they wouldn't have to drive in. And so it's been pretty streamlined for our agency, but it's different. Part of therapy is being in that moment, right? Creating that safe space. And while, through a computer we can see each other, but you're not there in the moment, you're not fully connected with that individual. So that's been a little bit hard to, still carry out our techniques and practices and not have that room where we're sitting in, right? And then you have external distractions that can happen because most of them have their kids home or their siblings are home, or so there's other distractions. And so just trying to kind of manipulate our techniques in order to keep attention and to really engage the client. There's been a lot of really cool things. I work with a lot of young kids, and I thought it'd be super stressful for them, but it hasn't. They've been super excited to show me their room and show me their backyard and the things they do. As long as I don't get seasick from them moving the computer too much, we do good with it. So it has been kind of difficult for us providers in the sense that our camaraderie is not there, right? We're not able to see our other therapists when we come out of session and things like that. So kind of making sure that we're engaging socially as well and not just behind a computer screen. And then there's the blue light issues and screen fatigue, and so just trying to make sure that people are aware of all those things.
Right. That's a very good point. Dr. Layton, I want to ask you a bit too about maybe our feeling of control. Normally when we're in more normal times, I think we all feel we have somewhat control over some things in our lives, not everything, of course. But these past few months, it seems like we've maybe lost a little bit of that because we don't know about our job situation maybe, or school situation with our kids. We don't know about being able to visit family and friends. We don't know if we're able to do some of these different things, that we really kind of lost a lot of that control over some of these things. And that must have an impact as well on folks, doesn't it?
Absolutely. So control is an illusion, right? And in our training, my training of EMDR, we know that when people try to be in control of things, it's because they seek safety. And so if you look at it from a perspective of, I'm not safe, so therefore I'm going to control as much as I can to provide safety, it's still kind of an elusive thought. but it makes us feel more safe. And so this has really kind of stripped us of that, right? We don't even know if it's safe to get groceries or safe to pump our gas or safe to take our neighbor, a cup of sugar anymore. Like, we don't really know because we don't know who has been infected or contracted this illness. And so that kind of startled everybody in the sense of, where do we get our safety from, right? And then, of course, unfortunately, we have lots of people that are in really toxic environments, and school was their safe ground, or going to therapy was their safe ground, or Boys and Girls Club, or any of these other things that we're not allowed to participate in were kind of the hopes that a lot of these people and or kids had. And so definitely making sure that we do our due diligence of checking in, if we hear bizarre behaviors or noises nearby us, and just making sure that we're still kind of engaging and caring for one another, even though we can't physically be in that proximity.
Very good. Thank you very much.
Yeah, thanks for coming on. We really appreciate your time.
Sure.
Thank you, Dr. Layton.
You guys have a good day.
You're very welcome. Some good advice. We appreciate it very, very much. That's Dr. Amber Layton, and great advice. And I think, we're all in this together, as we keep saying.
That's right. That's right. So it's
you
always helpful. I hope they never send us the bill.
I know. All these doctors.
I'm waiting for all the doctors
we've
to be
talked
like,
to.
oh, yeah, so here's your back pay.
Right. Yeah.
Whew.
But there you go. We appreciate that.
No, they're just speaking out of their own generosity and experience.
Yeah.
So.
Well, and that's good, because they're experts in their field and we are not. And so we're glad to talk to them.
And we are just talking heads.
That's what we do.
That's what we do.
But right. But there you go.
But hey,
another guest
on the phone.
On the phone. Let's go to the phones. Good morning. You're on KSJE. Thank you for calling in. Can you hear?
Yeah. I can hear you. Good morning.
Good morning. And this is
Rashawn Ramon.
Rashawn Ramon from San Juan College, right, Rashawn?
Yeah. I am. So I work for an organization called InterVarsity Christian Fellowship. I am a campus staff, and I'm part of a club called Name InterVarsity.
Right. And Rashawn, what kind of stuff do you do? I mean, I know because I've been around you guys, but for listeners who are unaware of what your group does, what kind of population you tend to see and serve, can you tell us a bit about that?
Yeah. So we're college ministries on campus, and our vision is that we're a community of native nation students who laugh together, love Jesus, and love our tradition people. And and we just want to be able to reach towards the native students at San Juan College, and just be able to do events on campus and off campus. We do Bible studies, prayer meetings, and family dinners.
Right. And that's been so important because all of those before this happened were in person. And I know that was, like Dr. Layton just said, it was a safe place for students and adults to come together and be with each other and support each other. And I know because I've sat in a couple of family dinners that there were some significant situations that folks were being supported through. So what's it been like to have an absence of that physical presence? What have you guys been doing in the meantime?
Yeah, and I think ever since when the stay-at-home order started, and then classes were transitioned online, I just thought how can we be able to communicate? How can I be able to communicate with students? And so far we've been just communicating through Zoom, and we've been using Zoom a lot ever since March, and just using it for Bible studies, hangouts, and then prayer meetings. And the interesting part about this is that I work with another campus staff at another college at Fort Lewis, and it all started with them doing their own meetings every Wednesdays, and then all of a sudden they wanted to invite other students. So some of the students from San Juan started to be involved with it, and then it reached out to in general all native students throughout the throughout the United States. Like we got a student from New York to a student from Hawaii, and we just started like reaching out to folks to just have an online community.
Very good. And Rashawn, let me ask you a bit about the students that you are working with and helping. Of course, and they wrapped up the spring semester here at San Juan College. The summer session has started now, and most classes, again, remain online. And so in your experience, are students being able to make that transition to online instruction, or is there some things that they miss with not having face-to-face classes?
Yeah. From what I've been hearing from some of them is that like they when they finished the spring semester, some of them have told me that they had to like drop their courses, some of their courses, but still remain a student, and yeah, they felt a little discouraged about that, just dropping a few courses because they didn't expect to take their classes online, and then they felt like they wanted to just try to finish the spring semester. So yeah, they I guess in the first place they didn't expect this to happen. But also like they do want in-person meetings. But also at the same time, like they feel like they still want to be safe too from this pandemic.
So not all students live on the res. Of course, people live all over the place. But as far as those who do live on the res, what's that been like? Because we also know that Wi-Fi is a little spotty. I know in the beginning I offered my second job offered a space for Wi-Fi access or whatever. Has that been just yet another hurdle for you guys?
Yeah. It's what I've been hearing is that like they would use their like their phones as hotspots, and they've been just using that like this to be able to communicate with other folks, and also like with their classes, and I guess for us as ministries, we wanted to like just try to help them by purchasing Chromebooks from them, and we applied a grant for this to be able to apply for Chromebooks. But also we wanted to like provide hotspots, but we never really knew how to be able to like how to go through that, and some of us are just new, like we didn't went through training to how like get hotspots, but we're on that we're still on that process of like wanting to provide hotspots. And I know that the college is providing hotspots, but we just felt like the students that we know, that we just wanted to like provide them, mail it to them, but we're still in that process right now. And so what I know is that some of them do have internet, but they feel like they're using their phones to do their classes and try to communicate with other people.
Yeah, it is a strong learning curve. I didn't realize until after.
For the teachers too.
Yeah, right. Scott just made it about him.
I'm just saying.
No, it's true. It's true for all of us that do in-person work.
And not just college, but the secondary schools.
Anywhere.
Yeah.
Totally.
Everybody. Anyways.
Everybody's had to move online.
Yes.
And none of us were ready. I think it's
That's
the ultimate lesson
Very
there.
true. But kudos to the students who are making it work.
Yes, exactly. And the leaders who are making it work. And so just sort of a final note, if I was a student at San Juan College and I wanted to get involved, how would I do that?
Yeah. You can definitely get involved by checking out our Facebook group page. It's Native University at San Juan College, and we also communicate through Instagram. It's SJC Native University 2020, and also we have a Snapchat. So and then the students who are leaders in this group, they have been like this inviting other people just to be able to just like join our online community, and we would have like meetings on Wednesdays, every Wednesdays, and just to be able to be part of like just to be able to meet other Native students from other parts of the country too as well. So it all starts with if they want to check out our Facebook group page.
Very good. Rashawn, thank you for joining us this morning.
Yeah, thank you. Thank you for inviting me.
You're very welcome, and thanks for the work that you're doing with the students here at San Juan College, and we'll chat again.
Okay. All right. Well, have a good day.
All right, you too. That is Rashawn Ramon. He is with the Native InterVarsity Club here at San Juan College.
That's right.
Very good.
Very good.
That was interesting. I mean, that was interesting to me. I learned a few things.
Yeah. I'm the faculty sponsor for them.
All right, well, there you go.
There you go.
Well, now it explains why we got them
my
on the
special
show.
affinity.
Yes,
well,
but good.
and also I've just seen how it's positively impacted the lives of students. There have been a number of difficulties that I've seen
Right.
come up over the past couple of years that have been handled well within that group.
Nice.
So,
Well, I know, San Juan College spends a lot of time and resources of helping students succeed who come here, whether it's online or face-to-face or whatever the case may be. And it's groups like this that help those students to complete
right.
their classes, to succeed, and if they have to now go online, to figure it out.
That's
if you
right.
need a hotspot or you need help with Wi-Fi, these are the services that the college provides, which I think is great. I don't think you find that everywhere. A little plug to San Juan College.
yeah, as we should. We should absolutely plug San Juan College.
Yeah.
Not just because we're here.
Right.
At San Juan College,
We
but
are
also
really here, but
it is like we say about our show, our station,
Yes.
right? Community supported, and it's a beacon of the Four Corners.
It is.
I think
Right.
San
The
Juan College,
is a
in a lot of
beacon.
ways, is a beacon of the Four Corners. Yeah,
That's true.
totally.
Beacon of learning.
Oh,
There you are. And on that note,
let the beacon guide you home.
That's right.
On that note,
exactly. The shining light.
the shining light of the Four Corners.
Exactly. And we're that shining light in sound. Wrap your head around that.
Yeah, I know. I'm like,
As we
whoa.
go off the air.
Yeah, that's sounds
Yeah.
like physics.
Kind of.
I'm gonna consult
Yeah.
the physics guys down the way.
It's kind of like that.
Yeah.
Well, time is fluid.
Time is fluid.
Yes.
Always
And
has
shining
been,
brightly.
always will be.
And time is shining.
brightly. And yes, long and the short of it, thank you, San Juan College. Thank you, San Juan College student groups.
There you go.
And we look forward to all reuniting in person whenever we possibly can.
That's true. Very true. But thank you all for joining us this morning for our local COVID-19 information program. Again, it is rebroadcast at noon on KNMI Radio, 88.9 FM. We appreciate that. And again, here at KSJE Radio every afternoon at 5:06 p.m. And, of course, online at ksje.com during that time as well. So
Till next time, see you tomorrow.
we'll see you tomorrow, everybody, at 9 a.m. Have a great Tuesday.